In binge eating disorder, you have the same binge eating that occurs in bulimia nervosa and anorexia nervosa binge purge type. The binge eating in binge eating disorder is associated with 3 or more of these specific criteria: eating more rapidly than normal, eating until uncomfortably full, eating large amounts when not hungry, eating alone due to embarrassment, and feeling disgusted with oneself or depressed or guilty. It causes marked distress, and it occurs at least once a month for 3 months. Like in bulimia nervosa, there is partial and full remission, and severity is determined by binge frequency occurring along a range of once a week or mild to 14 or more times a week or extreme. Psychiatrists should have a high index of suspicion for the presence of binge eating disorder, which is the most prevalent eating disorder. The 7-item binge eating disorder screener, or BED7, is an easy-to-administer self-report screening instrument of high clinical value. Patients may not present with binge eating per se. Any number of associated medical and psychiatric complaints, for example, depression, anxiety, and issues around body size, shape, and overweight, may be prominent. There have been a host of drugs studied in the treatment of binge eating disorder, many more than in bulimia nervosa. A number of antidepressants have been found in randomized double-blind placebo-controlled studies to be effective in reducing binge frequency and/or number of binge days, including tricyclic antidepressants, SSRIs, and duloxetine. The anticonvulsants topiramine and zonisamide and the norepinephrine dopamine reuptake inhibitor atomoxetine have been shown in randomized double-blind placebo-controlled trials to not only decrease binge eating but weight as well. The pre-drug lisdexamfetamine, which is metabolized into methamphetamine, has shown the most powerful effect in binge eating disorder, such that it received FDA approval. The key points are as follows. Binge eating disorder is the most prevalent eating disorder. The binge eating disorder screener, or BED7, is a good screening instrument. A number of psychotropic agents have been found to be effective in binge eating disorder.